We're going to turn it over to the next panel. I am pleased to welcome Breana Turner, a Birth Equity Fellow with Health Connect One and a PhD candidate focusing on Black women's health and wellness, to the stage to moderate a discussion about a new paper from the Policy Center unpacking the role of doulas in maternal mental health. Breana, it's yours.
Good morning. Is this on? Good morning, everyone. Thank you so much for being here, and also thank you to the previous panelists for the enriching discussion. Like she said, my name is Breana Turner. I'm currently a Birth Equity Fellow at Health Connect One. I'm standing in lieu of my amazing boss, Twyla, and I would like the panelists to go ahead and introduce themselves.
Great. Hi, everyone. I'm Regan Moss. I'm a first-year doctoral student at Tulane studying social and legal epidemiology, and here at the Policy Center for Maternal Mental Health, I'm a program and policy analyst.
Hi, everyone. My name is Salma Mohamed, and I am a manager of perinatal and maternal health policy at Mass Health, which is Massachusetts' combined Medicaid and children's health insurance program. And at Mass Health, I focus on the implementation efforts of the doula services program and also on perinatal behavioral health policy, alongside my colleague that presented yesterday, Swathi Damodaran, and we are also government agency fellows as part of the Policy Center.
All right, thank you so much for those introductions. So I know that we are here about maternal health, and many of us already know what a doula is, but I am going to read off a definition just so we can ground the conversation here today. So doulas are birth and postpartum non-clinical trained professionals who can provide emotional, physical, and informational support during pregnancy, delivery, and after childbirth. We also know that doulas have an integral role of making sure that the maternal morbidity and mortality is decreased. They also help empower birthing persons as well as women throughout their pregnancy journey and postpartum. And there's just so much very rich evidence and data to support the importance of the doulas, especially as it pertains to maternal mental health. So I'm so excited to continue the conversation here today with these amazing women. So the first question is for Salma. What is the doula landscape in the U.S. relative to the overall training, certification, and reimbursement?
Yeah, thank you for that question. So the doula landscape has evolved tremendously in recent years, with growing interest and awareness in the valuable role that doulas plays in improving several perinatal, infant, and maternal health outcomes. A lot of the data coming out of that shows that doulas can improve lowering C-section rates, the likelihood of preterm birth and low birth weight infants, reducing risk or increasing the overall positive birth experiences for birthing people, as well as reducing disparities, which is particularly of interest for our state Medicaid agency. Doulas are known to reduce disparities for low-income folks and families of color, and a lot of the reason for that is that doulas are often, particularly community-based doulas, often represent the identities of the communities they serve. And so Mass Health is now covering doula services, which is really exciting. We are part of a growing network of state Medicaid agencies that have started to cover and actively reimburse for doula services. So we are currently one of 20 states, which is really exciting. And across the nation, there are varying eligibility requirements as well as certification and training requirements that vary from state to state. And a particular challenge in really the uptake of covering doula benefits is the fact that there is no certifying body across the nation for doulas. And so in the ways that maybe like lawyers or doctors have a board that regulate training and licensing and ethics and standards of care overall, doulas don't have a similar body acting in those ways. And so in Massachusetts, at Mass Health, we collaborate closely with our partners at the Department of Public Health, who are working on developing a certification process in the state to ensure that doulas are trained and educated appropriately to serve the needs of residents in Massachusetts. As of December 8th, Mass Health does cover doula services, which is very exciting, for supports during pregnancy, labor and delivery, and through 12 months postpartum. And as of November 8th, we've extended coverage to adoptive parents of infants of up to 1 year of age, which is incredible. And yeah, thank you. And our network has grown significantly and exceeded lots of our expectations. And so we have a diverse network of over 20 doula providers that work to support our birthing members. And Mass Health covers 40% of births in Massachusetts. So as you can imagine, there's a lot of impact here to improve outcomes for our members in particular. And so in the actual eligibility requirements for becoming a Mass Health provider, doulas have to meet a certain level of core competencies, and included in that are core competencies relative to mental health conditions and complications, including substance use disorder and perinatal mood and anxiety disorders. And so we're really interested in making sure that our doulas are well equipped and trained to support our members.
I love almost everything that you said. It was very enriching. But just a couple of things that really stood out to me was the importance, like you said, that doulas help reduce that C-section rate. And C-sections within birth can be extremely traumatic. And so being able to go ahead and reduce that C-section rate also prevents some mental health disorders later on related to a traumatic birth experience. And so it's amazing how I like to say that we have to preserve life for those who bear life, and being able to have a doula that is culturally competent, that is in the community, and they get paid also. My pronouns are pay me. I like to joke with people about that, but they also, it lowers the barrier to access for those individuals needing that doula. It definitely helps preserve life for those who bear life. So thank you so much for sharing that, as well as just your organization, all the great work they're doing. But now I want to turn it over to Regan. Your question is, tell me about the report and why was it developed and the methodology. And also, again, I just want to acknowledge that Twyla also worked with you, my amazing boss from Health Connect One. So I'll let you take it away.
Yeah, sweet. Thank you. And thank you for the shout out to Twyla. That was going to be my first thing. So recently, last week, the Policy Center, we released a report describing the role of birth and postpartum doulas in addressing maternal mental health needs for their clients. As you both shared, doula support is associated with a host of positive outcomes that are emotional, physical, social. And we wanted to really drill down the specific role that doulas were playing in improving their clients' mental health outcomes. The Policy Center, as Joy said earlier, has done a lot of work with peer support specialists and community health workers. So this was just adding to the portfolio of support professionals that were outside of the clinical care team. So in order to answer the question of what the role of doulas is, we went to doulas and community-based doula organizations, as well as national and international organizations that provide opportunities for doula training. And we compared the components of their doula training and how they described the role of doulas to core competencies that the California Maternal Mental Health Task Force developed a few years ago. The Policy Center helped champion this list of core competencies, and we wanted to see if how we were describing the role of doulas was in alignment with doulas' own understanding of their scope of practice. So methods-wise, in addition to looking at the training components that these certifying organizations described on their websites and in training materials, we also surveyed directly community-based doula organizations. Their training components weren't as explicit on their website, so we went directly to them and surveyed and asked them how they were educating their doulas to be able to respond to maternal mental health need. And then through a national listserv, we surveyed doulas themselves to ask about how maternal mental health is showing up in their practice.
Awesome. Thank you so much for that. And so I know that you mentioned some core competencies, and I'm going to go ahead and summarize some of the key core competencies. So the first one is understanding the signs and symptoms related to maternal mental health. Second one is acknowledging and understanding the valid screening tools, where to find them, how often to screen. Then also knowing the role that providers and how to refer to the prevention of the treatment or whatever that treatment option may be. And also the relationship between breastfeeding and maternal mental health. So, after saying that, and I'm saying that out loud, you already know it, like the back of your hand, but what were some of the key findings in relations to those core competencies?
Yeah, thank you. I have my handy moleskin here to make sure I hit all the key findings. So the first thing is that screening is outside of the scope of doulas. So doulas as non-clinical support professionals, as you said in your definition earlier, do not feel that screening falls within their scope of practice because it is the first step of receiving a diagnosis. So they described that as being clinical in nature, and that was not something that they were doing with their clients. However, a few respondents did say that they educate their clients on screening, so that way when they're entering a clinical setting, it's not the first time that they've been asked some of these questions. They're a little bit more familiar and comfortable, and they're also able to advocate for themselves and know that that is something that they can ask from their providers. And then secondly, while screening fell outside of the scope of doulas, education and referrals were squarely within the scope of doulas. So when it came to referrals, doulas provided their clients with a host of resources, both online, local, and also some in-person resources. And they provided these referrals throughout the perinatal period. So some of our respondents shared that regardless of who their client was, they made sure from the moment they had their first visit, they'd set them up with a resource list and referrals, and they were able to go ahead and start connecting them and making sure they helped their client find the right provider. And then others shared that it kind of depended on the client that they had, whether or not they were high risk or they had some social risk factors or not. And then when it came to education, doulas shared that it was core to their practice to be able to ensure that their clients knew about postpartum depression, about depression during pregnancy, anxiety, and we saw an opportunity for doulas to expand and include the full spectrum of perinatal mood and anxiety disorders and recognize substance use as well as things like OCD and maternal psychosis. And then finally, when it came to looking at the results from the doula certifying organizations, none of the national and international organizations really championed maternal mental health as fully as they could have. All of them recognize that maternal mental health is in need of clients and that doulas can play a role in educating. But when it came to the exact steps of how they can educate or how they can refer, they fell short. There's some room for growth there. The last finding is our community-based doula organizations. We're seeing that they were doing better in educating the doulas, and they, in many instances, described that they had to create their own trainings to make sure that they were giving the doulas that came to them for training kind of the full spectrum and the full scope of perinatal mental health.
Thank you so much. So something that really stuck out to me is that it seems as when doulas are they're confident in their ability to recognize these different mood disorders and address maternal mental health, that not only empowers that birthing person, but it also helps them as a doula. So it's very cyclical, right? And so I want to turn it over to Salma, because you are a doula. And so what are your thoughts about the maternal mental health as a doula, your own practices, and just tell us a little bit about that and your experience.
Yeah, absolutely. Thank you for that question, Breana. So I think what's really important to this conversation is understanding what's within and out of scope for a doula provider. And I think Regan does a lovely job in this report of outlining a few of those things. And as an Medicaid state agency, we have done our best to try to navigate that slippery slope where we want to raise awareness with our doula providers who are in our network, while also balancing our understanding that there's an entire system that needs to work in support of our members beyond the doula as well. And so we've developed several resources for our doula providers when working with members who have higher behavioral health needs. And that includes leveraging our managed care plans to do their part in care coordinating and also referring out to more clinical supports. And so we really want to do our best to make sure that our doulas are not overburdened. A lot of people are starting to identify that doulas do play a critical role in this space in referring and resource navigation, but they're not the only solution. This is a multi-pronged approach, and we need a robust network of providers who can support identification of mental health and also referring and treatment as well. And so in my own practice as a doula, I definitely remember some of the early days where it was really hard to not only identify, but also refer adequately, especially when there's a lot of hesitance with a member where concerns for maybe criminalization, getting kids taken away. And, this always increases as well with folks who are more marginalized, Black mothers in particular. And so I think relying on a really strong network of other doulas who have more experience and having mentorship is really critical to this space. And there aren't really formalized pathways to develop these kinds of networks for doulas, especially as the workforce continues to develop. More training, more continued education, and more mentorship is definitely going to be needed. But as a state Medicaid agency, we really are developing new resources that say, hey, you're working with a member who you've identified has additional behavioral health needs. Here's where you go for support. Here's what the managed care plans are required to do. They need to do baseline care coordination supports. Please let us know when those services are not working out or the gaps that you're identifying. And so in my work at Mass Health, I do a lot of outreach calls with our doula providers because as part of our program, we have prior authorizations where doulas can reach out and say, hey, this member needs more services beyond what is covered. Can I get additional time with the member? And we work with the members and the doulas alike to make sure that they're well supported in connecting them with the right case managers and following through with the managed care plans that can offer more regionalized community-based supports, and then also connect for screening and referrals and treatment. And so I think it's going to require a lot of collaboration from all parties and recognizing that doulas can only do so much alone. And so really need to rely on all of our parties in the system.
Absolutely. And I want to summarize everything that you just said, but I don't want Stacey to come up here and take us off with a cane. So that being said, just kind of rapid fire to wrap it up, but I'm going to turn it over to Regan first. What should be one of the key takeaways from today's panel that you want the audience to grasp? Or what is your mic drop moment that you can just impart on us?
Yeah, I don't know if it'll be a mic drop, but hopefully a good takeaway. To your point, when you're talking about mentorship, continuing education, and the first step in their initial certification, there's an opportunity for doula organizations that are local, national, and international to really scale up the focus on maternal mental health, and that requires investing in supporting community-based doula organizations and national organizations, such as by supplying scholarships for doulas so they can get access to these continuing educations, and also providing more structural support to help develop out better training materials.
Yeah, I agree with everything Regan had just laid out for us. I also think it's really important to just bring all players to the table, especially doulas, and centering them in the policy and decision making as more states uptake doula services, and also having conversations with providers on what a doula is and how they can support and how we can create better pathways for communication so that doulas are recognized as an integral part of care teams, are very necessary, and sometimes have more insights than a clinical provider may have because they have that trusting relationship with the member. And so doing whatever we can to best support our doulas will support our members and all of our perinatal population. And also recognizing doulas can't do this work alone. Birth worker burnout is real. And I think it's going to be increasingly important for systems to create more supports for doulas, including sustainable pathways for reimbursement, but also more supports for mentorship, community collaboration, and also mental health supports for doulas themselves.
Awesome. We know this being in this room today and all the work that we do, there's always more work to be done, but also at the same time, it's so inspiring and encouraging to hear about the work that you both are already doing that's making significant changes for maternal mental health and just maternal health in general. So thank you so much, for sharing your time and your insights.